I started here almost 5 years ago, and we've grown to be almost doubling in size or more of radiologists, over 1 million exams. And, post COVID, been this extreme growth in radiology, and growth of exams across the country that's going to progress to be doubling over the next 10 years. So, with that in mind, I'm in this podcast thinking how I'm going to use AI to help us deal with that, because we grew faster than expected post COVID, and now we're going to grow even faster. And that's happening across the country. Unparalleled growth in imaging. There will be a near doubling or doubling over the next 10 years, 14% compounded annual growth rate of imaging by the year 2034. And I have this 50% rule for radiologists, right? 50% in burnout right now. 50% have changed their jobs in the past 5 years. And we've lost about 50% of our professional fee reimbursement in the past 10 years. So we don't want to create a situation where we burn them out further. So how can AI help us? So my lead into this discussion is essentially that it has to help us work smarter, faster, with higher quality, but be patient-centric and get to patients to where they need to be, and with the more urgent findings, essentially finalized, but also to where they need to be faster, like referred to their appointments, their follow-up imaging, etc. So it needs to be more patient-centric and radiologist-centric at the same time. So one thing might be called the prioritization advantage, or basically how quickly a positive finding is identified and the patient is moved along the care pathway. And one of our use cases with incidental pulmonary embolism, for example, we are finding about 1% of our patients, because it's like a 10 to 50 times higher rate of incidental pulmonary embolism, lung clots, in patients that have oncology. We have over 50% oncology patients. And so what we were finding is these people would show up to the clinic, and with those, with having low staffing, high volume, we were worried that those outpatient films, not necessarily inpatients, we had good turnaround times, but outpatient films having things like lung clots would sit around too long, their disposition could get worse, right? So we wanted to make sure those were prioritized to the top of the reading list. And so that's one of the reasons we looked for value in identifying patients with potentially life-threatening diseases earlier in outpatients. And we've moved this now to other areas outside of lung clots. But we noticed that the buy-in from physicians using communication apps, seeing the findings, the patients going straight from the outpatient clinic and knowing that, hey, you know what, before you leave today, we found out you incidentally have a lung clot. Here's what you need to do. Worst case scenario, only a small minority emergency room. Most of them would be followed, put on anti-clot medicines, etc. They're happy. The referring providers are happy. We're happier that we're not letting people walk out the door with a serious condition.